Hi, Don here. Welcome to Podiatry Practice Mastery, where I'm trying to help bring your practice to the $1 million mark and beyond in your personal production in your clinic. So I'm going to go over the day. This is a recording of a Thursday, and kind of some good and bad things here. Okay. So first patient was a 37-year-old guy. I did arthroplasty 5 digits. I did it 1 foot, and then like 6 months later I did the other foot. He's feeling much better with these, and that was kind of quick post-op. Now, luckily, I think he traveled afterwards, so he's actually at 92 days post-op, so I could actually do an office visit now. So usually post-op windows are not quite that perfect, but this one was. Next patient was a 68-year-old patient that was put on Lamisil. I put them on a prescription of Lamisil. They also had IPK. I did lesion destruction on that today. And I did an office visit because I haven't seen them for a while. Next was a 42-year-old. Same thing. Actually, theirs was a wart, sorry. Theirs was a wart. This other one was a poro, or IPK on the 5th med head. I did an x-ray, and they also had a tailor's bunion, and I kind of reviewed the cause of that, anatomic shoes, come back as needed. Now, one of the mistakes I've been finding, we have some new staff, and a lot of times they're not doing x-rays, and so what happens, if they get x-rays, it makes it much more efficient. If they come in and ask, hey, should I get x-rays? Well, no, I'll go see the patient first if I'm not doing anything, and then you can get x-rays after. But I try to have them always get x-rays before, and I prefer them to err on getting them when they shouldn't versus not getting them at all. Next patient was I removed pins from some hammer toes. He had a bunionectomy and hammer toes, so this is a post-op one. We did x-rays for him. Next one was a 69-year-old. She is 4 out of 4 for non-radial only Shockwave for a fibula fracture. She's feeling great at 4 weeks, and I'm actually have her in a boot 1 more week and then transition her out of the boot. So I think that doing focused or non-radial shockwaves, because we have both soft wave and focused shockwaves, so we just call them non-radial. I did soft wave specifically for this one, and she's feeling so much better at 4 weeks, reduced swelling, ready to go ride her horse again like she wants to, and I think it's sped up the recovery for this patient. So that's the reason for doing shockwave for fractures. Not that it might heal the fracture a little bit faster, but the return to activity is quicker. She's super happy. She actually did a video. So just so you know, I'm starting to do more videos these days. I use SubMagic, so good testimonials on things that I want to put on my website, like we're doing a new webpage on urgent care on our website, and so I'm getting videos talking about, hey, I should have came to see you versus going just to the urgent care where it was a waste of my time. So she was really happy, so I'm going to put this thing on the Shockwave portion of our website. Next patient was a Qutenza number 1 for a diabetic patient. Next was a 71-year-old female, plantar fasciitis number 3 out of 3 for Shockwave. For some reason, I only did 3 for her. I don't quite remember the initial conversation, but I did plantar fascia and Achilles. She also was scanned for orthotics today, and I'm going to see her back at the orthotic follow-up. Next was a 12-year-old little boy, flat feet, brought in by his mom. Talked about custom orthotics for him, and we did scan him for orthotics. So that was orthotic number 2. Once again, my goal every day is to do two pairs of orthotics at least, so that was my second one. Next patient was another IPK, and I did lesion destruction on that. They're going to come back as needed. Next was a ankle sprain patient, 73-year-old. We did an ultrasound. It showed some tendonitis to the dorsal foot region, so we're going to do PT for her. And I talked about shockwave if it doesn't get better, but she's not in that much pain. Next was a 46-year-old female. We did cortisone with an ultrasound. She went kind of like the least expensive types of treatments. She was seen like 6 months ago and just was kind of dealing with her plantar fascial pain. So we did cortisone for her, and I'll see her back as needed. Next patient was a 71-year-old. He had pain to the 2nd metatarsal head, and I did so this was a kind of a interesting one. I did cortisone. He kind of wanted cortisone plantarly to like I didn't go into the joint, but plantarly I did a cortisone for this one. and I'm going to see him back in about 3 or 4 weeks. Next was a 69-year-old with a infection that was sent over to the office for evaluation. He's already getting better. He had a paronychia to the base of the base of the hallux, and it popped on its own. The pus came out, and he was feeling much better. Next was a fifth-digit medial aspect exostectomy. I did that in the office with a bone rasp. That was probably the MVP patient. Like these things, flexor tenotomies and these exostectomies and matrixectomies and all these things are really the most valuable patients for these little procedures in the office. They're really efficient and they do well. Next patient was a 43-year-old that got a Lamisil booster. Next patient was a 27-year-old that had bilateral plantar fasciitis. She got the foam rollers, bilateral ultrasound, bilateral x-rays, and I'm going to see her back in 4 weeks. Now her fascia was not all that thick, so I think the equinus was the dominant force for that. Next patient was a 64-year-old female. This is one that I've been treating number 6 out of 6 for Shockwave for her peroneal tendons. She also has some subtalar joint arthritis, and I did a video for this one as well, showing like the subtalar joint arthritis. The other doctor wanted to fuse it, but all was hurting her was her peroneals, and so we did 6 sessions of Shockwave. She's much better. She actually gave me goat cheese last time, and so we made caramelized onion and goat cheese, if you wanted to know what we did with that. And I thanked her for that. And then next patient was a number 3 out of 6 Shockwave, and then the last one was this is one of my favorite patients. He is a type 2 diabetic that I amputated part of his hallux, but then he actually listened to me and did intermittent fasting and ketogenic diet. I used to preach that a lot to my patients, but he's been still doing OMD, which is 1 meal a day for his fasting, and his A1C is like around 6, doing much better, and he's a motivation now, inspiration to me, because he's doing so well. So that was the day. I think those in-office procedures were really the most beneficial ones, and been doing well for the practice. So once again, if you guys have some great cases, send them my way. I'll be happy to present them. If there's other things that you are doing that produce a lot of revenue and help you to get to the $1 million mark, I'd love to know what you're doing. Okay, shoot me an email, Don at podiatrypracticemastery.com, or if you have any questions about things that we talked about. Thanks.